Hey everyone, welcome back to our channel. Whether you're experiencing symptoms of thoracic outlet syndrome yourself or just curious, stick around as we cover the causes, symptoms, treatments, and some exercises for immediate pain relief. Let's get started. Thoracic outlet syndrome occurs when the blood vessels or nerves in the space between your collarbone and first rib, known as the thoracic outlet, become compressed. This can be due to several reasons, such as poor posture, repetitive arm movements, trauma, anatomical defects like anaphonic, extra rib, or even pregnancy. These factors can lead to compression of nerves and blood vessels, causing the variety of symptoms associated with TOS. Now, let's talk about the symptoms. TOS can cause a range of symptoms depending on whether it's affecting the nerves or blood vessels. Common symptoms include pain and tingling in the neck, shoulder, and arm, numbness in the fingers, weakness in the grip, swelling or discoloration in the arm or hand, and in severe cases, blood clots can form. Treatment for TOS often involves a combination of approaches. Conservative treatments include physical therapy to improve posture and strengthen the muscles around the thoracic outlet. Medications can help manage pain and inflammation. In some cases, doctors might recommend injections or even surgery if conservative treatments don't provide relief. It's important to work closely with your healthcare provider to find the best treatment plan for you. Now, let's move on to some exercises that can provide immediate pain relief. Here are 3 simple exercises. 1. Skeleton stretch. Sit up straight, tilt your head to one side, bring your ear toward your shoulder, hold for 20 to 30 seconds and repeat on the other side. 2. Corner stretch. Stand facing a corner with your arms at shoulder height, elbows bent. Lean into the corner, feeling a stretch in your chest and shoulders. Hold for 20 to 30 seconds. 3. Shoulder blade squeeze. Sit or stand with your back straight. Squeeze your shoulder blades together and hold for 5 seconds. Repeat 10 to 15 times. These exercises can help alleviate some of the pressure in the thoracic outlet and provide immediate relief. That's it for today's video on thoracic outlet syndrome. We hope you found this information helpful. If you did, make sure to give us a thumbs up, subscribe to our channel, Cerebral Mechanics, and hit the bell icon so you don't miss any of our future videos. If you have any questions or topics you'd like us to cover, drop a comment below. Thanks for watching and take care.